2 years ago, he made a promise to the NHS, here in black and white, his document. It commits to a minimum pay rise of 2.1%. It's been budgeted for and now it's being taken away. He shakes his head. His MPs voted for it. So why, after everything the NHS has done for us, is he now breaking promise after promise?
Prime Minister.
Mr. Speaker, he voted against the document in question, which is to crown the absurdity of his point. Under this government, we have massively increased funding for our amazing NHS, with the result, as I say, there are 6,500 more doctors this year than there were last year, 18,000 more healthcare workers, and 10,600 more nurses.
He says he voted for it. He did. And now he's ripped it up. 2.1% ripped up. Prime Minister, a 1% rise versus 1.7% inflation rise. That is a real terms cut. And if the Prime Minister doesn't understand that, we really are in trouble. He's had the opportunity to change course, but he's refused. So if he's so determined to cut NHS pay, we at least show some courage and put it to a vote in this Parliament.
Mr. Speaker, the last time we've put it to a vote, he voted against it. As I said before, we're increasing pay for nurses. We're massively increasing our investment in the NHS. We are steering a steady course, whereas he weaves and wobbles from one week to the next, Mr. Speaker. One week he's attacking us, saying we should be doing more testing. The next week he's denouncing us for spending money on testing. One week he calls for us for a faster rollout of PP. The next week he's saying we spent too much, Mr. Speaker. He's got to make his mind. One week he calls for a faster vaccination rollout when he actually voted, though he claims to have forgotten it, to stay in the European Medicines Agency. Perhaps he'd like to confirm that he voted to stay in the European Medicines Agency, Mr. Speaker, which would have made that vaccine rollout impossible. We vaccinate, we get on with delivering for the people of this country. We vaccinate, he vacillates, Mr. Speaker, and that's the difference.
Thank you.
Point of order.
Mr. Speaker, the Prime Minister, twice from that dispatch box, said that the Labour opposition voted against the NHS funding bill and the 2.1% increase for NHS staff. This is not the case. Indeed, in the debate, as Hansard will show, I was explicit that we would not be dividing the House. So can you, Mr. Speaker, use your good offices to get the Prime Minister to return to the House to correct the record? And do you agree, Mr. Speaker, that if the Prime Minister wants to cut nurses' pay, he should have the courage of his convictions to bring a vote back to the House?
Can I just say, first of all, it's not a point of order. It is certainly a point of clarification. That part has been achieved, but I'm certainly not going to be drawn into a debate, as the Shadow Secretary of State well knows.